And if Kapur, Dr. Kapurji, I'll mute yourself anyway. So, good morning, everybody. Today is Sunday. Today class is taken by Dr. Kapur. We are lucky to have her. But before we start, I want to just, I got a message regarding health, so you might find it interesting. I put that in Yoga with Sam group as well, so you can read that through in your own time as well. What the message says, the stomach, when you do not have breakfast in the morning, you affect your stomach. You create a lot of acidity in your stomach. If you don't drink enough water, if you take your weight, divide by 30, then you have a kidney problem. You have to drink plenty of water. At least, my weight is 90 plus, so I need to drink 3 liters of water daily. Gallbladder. If you sleep if you do not even sleep until 11 o'clock and do not wake up in the sunrise, before sunrise, then your gallbladder gets affected. If you eat cold or stale food, your small intestine gets affected. When you eat a lot of fried food and spices, your large intestine gets affected. When you in a smoking atmosphere, a polluted environment, then your lung gets infected. When you eat a lot of fried food, junk food, fast food, you injure your liver. When you eat meal with a lot of salt and high fat, which contain cholesterol, then you affect your heart. When you eat a lot of sweet, then your pancreas is affected. When you work on your mobile phone or computer with no light on in the dark, then your eyesight gets affected. These are all simple things, but very true. If you think negative, your brain gets affected. And the soul gets injured when you don't have family and friend to care and share with you in life, their love, affection, happiness, sorrow, and joy. Then your soul gets affected. So family plays a very important part to make your soul richer. If you have family, you're one of the lucky ones to make your keep it going as long as you can. All these body parts are not available in the market. So take good care and keep your body parts healthy. Drink plenty of water and so on. A glass of water after waking up helps to activate your internal organ, your bowel movement. Before the meal, 30 minutes before the meal, if you drink a glass of water, helps with digestion, helps to lower your blood pressure, because more than 90% of blood is made up of water. More water you drink, thinner the blood, the less chance of blockage. Glass of water before going to bed. A lot of people, like our elderly, we don't drink water in the night time because we think we have to go to the bathroom a lot. But if you drink glass of water before going to bed, less chance of a stroke or heart attack. More than 70% people die in night time. That's the fact of life. So really, these are simple messages I'm giving you. So when so please, if you read those things, if you like it, pass on to your friends and things like that. They are simple messages, but very effective in promoting overall health. Thank you very much for listening to me. And I'll pass on to now Dr. Kapur to start today's class. Om, Dr. Kapur, namaste.
Om, namaskar everybody. Jai Mataji, Jai Sri Krishna, Jai Shri Radhe. Let's sit straight. Hands are in Dhyan Mudra. Take a long deep breath from the nostril, chanting the word Om from the mouth 3 times. Om. Om. Saviturvarenyam Bhargo Devasya Dhimai Diyo Yonam Prachodayat. Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pashantu Ma Kashchit Dukh Bhag Bhave. Om Shanti, Shanti, Shanti. Let's all pray to Almighty for the universal wellness. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional. With these good thoughts, we'll start our session, keeping in mind all the precautions. Body is very different every day, every minute. So we have to follow all the precautions to get the best benefits and not to suffer. Hypertensive, heart problem, severe acidity, severe asthma, severe backache. Please do it slowly. When we come to the poses, again, it depends what group you are working with. If you are working at the golden age group, the senior citizen, you have to be very careful about the precautions. Now I say, when you have got high blood pressure, low blood pressure, backache, osteopenia, osteoporosis, heart problem, don't bend forward. No. So be careful, and we can always modify the poses. And that you learn with your own experience. That might not be taught you by any teacher or by any book. You practice yourself. They say the good teacher is that who has done her basic, and then she tries to have experience herself. And you can change. And idea is to always do some sort of exercise to get active. Otherwise, this body will be very stiff, because the body says, I'm not going to work at all. Unused dystrophy will come. So that's why the motion should be there in the body, depending upon your condition. And when you're going back, don't go back if there's any pain in your abdomen. Can be any ulcer, peptic ulcer, gastric ulcer, severe hyperacidity, or colitis. And other things are hiatus hernia or severe acid reflux, or any hernia of large size. Sometimes we get very small hernia after pinhole surgery. That doesn't matter, like pea size, that gets better. So these conditions always keep in mind, because I don't know what you are suffering and I am suffering. So this is, I take it as my verbal disclaimer. Follow your body, do as much your body give you order, because the first guru is your own body. So follow the instructions. Now today I will start with the one more thing. Recently, Shamanji was saying about drinking water before going to bed. Very good idea not to get this heart attack, and good for hypertension. But there is one more good thing with that, which I experienced. Taking maybe, let's say, one small glass of water, That works as an alarm for you. You wake up after maybe 5 hours, 6 hours, depending upon what is your routine. That's what I have found. By drinking that half glass of water even wakes me up exactly 5.5 hours. And my normal duration is 6 hours. And I am very odd with sleeping because that is from the childhood. I don't sleep early. I sleep late, maybe 11, half 11, maybe 12 some days, depending upon what I want to finish for the next day, prepare myself. And then 6 hours sleep, and that alarm comes on, and I get up. So this is a big advantage. Works like alarm. Thank you. So let's start today. What happened to you, Shamanji? I want to know about your eyes. Shamanji, what happened to your eyes? Please open up.
I had a cataract for early sign, just a small
I
patch,
see, cataract.
Yeah, so that's
So
why I gave me
cataract.
that's why I gave me sunglasses, just to not sunglasses, but bit tinted, so make sure damage is slow down. That's
Okay,
all.
because I thought of doing two subjects today. The first I thought eyes, how to improve the eyes. The second one is knees.
Okay, good.
So I can't cover both in one session because you know I work at my own pace.
Yeah, no.
So whatever you want knees today, maybe next week I can do eyes.
No, but
because
do the knees. I think do the knees. Knees are more important. I think for a lot of people have knee problems. Even I have knee
Yeah.
problems. Well.
Okay, knees problem is very common, as you say. Why we are getting this knees problem? The basic reason which I see is there are so many reasons, you know. Can be hereditary also, yes, and other problems. But they say not doing any exercise are giving you more knee problem. The word says motion is lotion. Motion is lotion. You are getting enough lubrication by doing your exercises. That's why they recommend do exercises, and the exercise can be done according to your condition. If there is a severe pain, don't do, just rest. Then as you are improving, go on starting doing exercises slowly, and then build up your stamina, and you can do the full range of exercises. There are multiple exercises, not 1, 2, or 3, and you can do according to your condition. Now, I will start very, very simple. Actually, the exercise start in your bed. That is the time the joints are so stiff. So when you are in the bed, the problem in the morning is, what is the problem? We want to go to the toilet. That is very difficult time. Now let's say I am suffering from severe pain in my knees. So what should I do? Gently I am moving my legs in the bed while I'm lying down. Gently moving my legs up and down. Other thing is, if there's too much pain in your knees, try to get something warmer, like a pad, heated pad you can put there. So that will help you to relax. But if it is not possible, you are alone and you haven't got that facilities in the room, you know, then don't worry. Put your hand on your knees. Do some clapping first. Warm up. Put it on your knees and gently move your knees. Gently, very gently. Your attention is on your knees. But again, if one limb move, whole body will move. This is well known. This what we are learning in our yoga practice when we are doing Ashtang Yoga. That's what we are finding now, that if we do one step, the other steps come. Like for example, when we start doing pranayam, with the Bhadrika pranayam, We are starting from the root chakras. Once the root chakras start, the rest of the chakras will be activated automatically. Same thing here. I am giving more attention to my knee, but the rest of the legs are also moving. Very good. You can do that also, your toes, your ankle, but main attention is on the knee, as I am talking about knees today. So do it very gently. Then you do flexion. You are in the bed, bend gently, put your hand on the knees, if you can manage. Flex, extension. Flex, extension. I am in the bed, Just imagine. Later on, I will come on the floor, So do that. And then try to rotate sideways. Very, very slowly. Because I'm suffering quite a lot, actually. Just imagine I am suffering. Then inward rotation. Inward rotation. Very good. Inward. Now, if you are get rid of your pain, then if you can manage to bend your one knee, make another leg straight. These exercises can be done in many positions actually. Sitting, lying down, stretching. Then take that down. Now I'm taking my left leg bent very, very little, not too much. The right one is straight. Idea is to give movement to the knee joint. Okay. Now by this time you are quite okay to leave your bed. The rest we'll be doing on our sitting on the chair. Now here, press your feet down on the floor hard. Sit erect. Put your hand on your knees. Press it hard. Press it hard on the floor and see what movement is occurring. Very good. The next one is, I am putting my heel on the ground, taking back my leg with the forefoot in. Heel is on the ground, which is coming back, and the forefoot is behind. Same thing. Now breathe in. Now pranayama is started from here. Breathing in and out. Put your heel on the ground, and while coming back, you are on your forefoot. See how much action is occurring. Very, very slowly. If there is pain, put your hand there on your knees. Go as far behind. 1, 2, 3, 4, and 5. Or might do 3, depending upon how bad. Again, 1, 2, 3, 4, and 5. Just imagine there is a paper underneath your sole and you are pulling and pushing that paper. So we are getting better. We can do with both. Very good. 3, 4, and 5. This is done. Now next is again rotation inside and outside. Bring your knees inward. Close your eyes and feel where the action is occurring. Very good. Very good. Outside now. Outside. I am getting on better. Very good. Very good. The next one is sit in the front of the chair. Take your leg on the right side. Very, very slowly. Now here depends how bad is the pain. Very, very slowly. Very, very slowly. Out. Other one. Go on breathing in and out. Pranayama is started already. We are doing Bhadrika Pranayam and go on chanting inside the Lord's name, whatever you believe in. Now you can do both together at your own pace, how far you can go. Maybe the pain is pretty bad, so I'm right here. I can't do more than that. Carry on slowly, very slowly. And then pain is getting on better. So you can go more wide. Now here you are helping your hip joint also, which is very common. The hip and the knees, they go together. Many people are suffering from hip fracture nowadays. So we are doing hip movement also, plus these muscles, we call it adductors. They are getting better. That's what happens when we do our butterfly even. Now let's say I am much better. So you join your feet as you do your butterfly. Join your feet at the sole and bring your knees up and down. Yes? Up and down. Go at your own pace. If you get pain, please stop there and then. And if the pain persists, consult your physician. Don't ignore. Because at this age, you are having maybe brittle bones, osteopenia, osteoporosis. And that's how we diagnose osteoporosis. This is a silent disease. It is inside, we don't know. Only we know when we have fracture after a minor fall or pressure. So do like this. Come in at your own pace. Now other ones are while sitting. On the chair I am doing. Today's your yoga, I think, yes? Now here, my knees are now getting on better. So I am doing now, raising my leg. You can put your hand on your knees, just 30 degrees. You know when we lie down and we do our Uttan Padasana? So I said this is sitting Uttan Padasana. 30 degrees. Hold it. And bring your toes towards your chest. See how much pressure is coming on the knee. This you can do even when you're lying down in the bed. Then take it down very slowly. Other one. Very slowly. 30 degrees. No more at this stage. Because we are going stepwise. Then take it down slowly. Breathing. Raise your leg up 30 degrees. Toes are facing toward my chest. By doing that, there's a lot of action occurring at your calf muscles. And I am activating my front muscle of my thighs known as quadriceps, because they are the muscles which are holding my knee joint. Hold it for 3 minutes, 3 seconds, 5 seconds, and as the going on, increasing your stamina up to 30 seconds or maybe 1 minute. And go on breathing. Pranayama is happening side by side. Then take it down while exhaling. Other one up. 1, 2, 3, 30 degrees. Take it down. Now you can do. Don't have a fall if you can manage. Take both the legs up. Uttan Padasana while sitting on the chair, which is very good Uttan Padasana for the all abdominal organs activation and for Nabhi Dharan also. Weight reduction when we are lying down. Then take it down while exhaling. Now, other one now you do. Knees are getting on better. Take it 90 degree and hold at the back. Hold at the back. Stretch your leg. See how much the pressure is coming on the calf muscles also. I'm going to activate my lymphatic system. Get rid of varicose veins also. Circulation is improving. Not to get the cramps in. Then go down slowly. Hands are at the back of your knee. I love my knees. Breathe in. Take it up slowly. Stretch, stretch. Now feel where the action is occurring. No rush. Enjoy yourself. Then take it down while exhaling. Now. Another one is, cycling is very good. Cycling. So put your hand on your knees and do the cycling. Pain is there, but not that bad. Little bit pain is better. No pain, no gains. Yes. Sometimes it's difficult to do going back, because if the pain is so much, you can't do that opposite gear, reverse gears. You can't do it. Other one, do as much you can do. Cycling you can do. There's so many exercises one can do. Very good. Reverse, you might not be able to do. Now my left knee is, this is right knee is worked, then the left one already has knee replacement. Some years ago. Okay, now relax. Now we will start with Bhadrika and then I will move over while standing how much you can do. Let's sit straight. Close your eyes, hands are in Dhyan Mudra. Lift up your spine, relax your shoulder behind. Breathe in from the nostril. Breathe out from the nostril. This is all diaphragmatic breathing. No mouth breathing. Try to take slowly deep breath in. Breathe in, then breathe out. While doing that, go on chanting Om. Breathing in Om, breathing out Om, or any other mantra you can do. When we do like this is known as Kaveli Pranayam, Kaveli, chanting the word Om during inhalation, exhalation. Inhalation is your Purvak, and Rechik is when you are exhaling. So during doing Purvak, go on chanting Om, exhaling, chanting Om. Kaveli Pranayam. Think positive. Think of the divine, the cosmic power. They are all giving us blessing. All the deities, my Guru, always with me, giving me so much strength and guidance, my parents, my close friends, they're all giving me good wishes. Now here I want to open up my lungs more. So do Chin Mudra, Dhyan Mudra upside down. This is going to make my lower lobes better on both the lungs, side of the lung, the right and the left, the lower part of the lungs. Plus, there's more benefit. Get rid of this low backache, which is so common. Chin Mudra. Next is Adi Mudra, the fist mudra. That is going to open up my upper part of my lungs. And try to concentrate on the lungs. Now this step is Ashtam Yog Dharana, focusing on one point. Here I am doing my dharana also. As I said, one limb will, the whole body will move. So that's what we are doing. Our focusing on one point. So that the mind doesn't go here, there, everywhere. On my lungs only, and other is on my breath. Me and my breath only. Visualize your lungs. There are 3 lobes on the right side of the lung and the 2 on the left, because the heart is occupying the rest of the space. And I am opening up all my alveoli where the exchange of gases will occur. I'm going to make use of all my lungs function. With the shallow breathing, they are hardly opening up 1/3 because they are dormant. Sleeping, jago, that's what I am doing now. Jago. Well done. Now raise your arms up. Rub your palms. Put the palm on your eyes. Feel the warmth going on your face, which is going to increase the blood circulation on the face. Once the temperature is coming back to the face temperature of the hand, open your eyes slowly, remove the hands, give a massage on your face, at the lower eyelids, We sometimes get puffiness there. And there are black patches also. Very common. We must have seen as we are growing on, these things are coming more and more. At the lateral angle of your eye, very gently. Then do the upper eyelid also very gently. And the eyebrows. Now this is going to increase my vision. Take away any problem of the eye, like watery eye, discharge from the eye, the cataract also. If you start doing it regularly, morning, evening, with other steps also, the eye exercises, and the tratak. Tratak is very important. Now here I am doing this known as temporal area. There's a temporal artery. If this gets inflamed, there's a lot of problem because it's cover whole of our face and the ear also. So prevention we are doing. That gives severe headache. And you feel if there is a big stone in your head, you can't even hear. You can't open your jaw even. One of my friends, she is suffering from temporal arthritis. And there is not much treatment, even in allopathy. Again, steroids. And you know about steroids. We all listen to Swamiji. Come down. Now do like this. One finger in front, another behind. Here we are activating a vagus nerve to produce more nitric oxide, which is required. Down at my throat area, not to get sore throat. Coming down, here are my thyroid gland. There are two lobes. And there's a bridge in between, isthmus we call. So activating my thyroid gland and do back because parathyroid gland is behind. There are four small lobes. These glands are very, very important. Then come down more. I am doing my thymus gland. This is also very good, take away all the anxiety. Plus for the immunity, the T cells. They are our warriors. Get rid of any bacteria, fungus, viruses. And then you can do rest of your body also because there is so much energy in these hands. Especially wherever you are having discomfort, your pain, like knees. Today our attention is on our knees. So go on doing like this, doing good massage we are doing on the knees. Now coming to Kapalbhati, that helps us for the arthritis. We all know that. Many of the diseases are being helped, whatever is there in the body. Especially this is more effective on the respiratory system, as it is called the king of the pranayama. Yes, lovely names are given. So, I think I will move over again to our now standing and doing knee exercise. Here, you are just standing still and give lot of pressure from your feet to the ground. See what is happening on my knees. Just stand like this. Now I'm pressing the ground with my feet quite hard. See, some action is occurring on my knees. Just straight. Press. Press hard. Press hard. Just go on breathing, do your pranayam. Bhajika pranayam is going on. By doing this, I am increasing my endorphins also. That will take away my pain, the painkiller, endorphin. Well done. The next one is only thing you need is, as we are inside all the time now, just need a chair. That's all. Chair, you now here, just stand close to the chair. Again, press hard on the ground. Make sure your spine is erect. Yes, spine is erect. Press hard. Press hard. Now you can do like this now. Very gentle. 1, 2, 3. See how much action is occurring on my hip joint also. And get rid of fat on my buttocks, gluteal muscles. Yes, carry on. Another one. Just holding the back. Very, very gentle. Now again, standing like this. Take it on the right side. Make sure the spine is straight, no bending. See? Other one, that side. Okay. Now, breathe in. Take your right leg up. You're bending your knee. So whole action is occurring at the knee and the calf muscles. They're getting tight, my calf muscles. That's going to increase my lymphatic system because the pump is there also. Do it for 5 seconds, 10 seconds, 20 seconds, 30 seconds, or maybe 1 minute. Longer you do it, better it will be. Never do in a rush because the muscles and the ligaments, they take time to warm up. And take it down while exhaling. Other one up. Breathe in. Up, up to your level where you don't get pain. Very good. You're doing very well. Hold it. Enjoy yourself. While exhaling, take it down. Up. And you can do many times. Start maybe 3 times, then up to 8 times, 12 times, 20 times. And repeat it during the day also. And feel the difference. Take it down. Other one up. See? Then take it down. Now the next one, very important. Take your right foot in front. The left is little bit away. at your own stamina, one can say. Now here, I'm going to bend my right knee. And here, both the feet are on the ground. See how much pressure is coming on the left leg calf muscle. And here, I'm giving exercise here in the front muscle, quadriceps. Some are coming on the hamstring, the back one. See, go down. Chest is straight. Go down more. Then you breathe in and come up very slowly, no jerks. I love my body. Now other one, reverse. The left foot is in front. Bend your left knee. The right leg is behind. Both the feet are on the ground. And this one is straightened up, not bending at all at this stage. Carry on, carry on, carry on. See, more pressure is coming on the right calf. Go down, then come up. Slowly. Hold it for some time. 3 seconds, 5, 10, 15, 20, 30. Very good, very good. Come up. Slowly. Relax. Take a couple of deep breaths in and out. No rush. We have done enough rushing in our life. No more rush. The next one is again the right foot is in front. The left foot is behind. See, this is good for the hip also. Now bend both the knees. And my heel of the left foot is up, away from the ground. Stay there for a short time. Enjoy yourself. More, more, more. And breathe in and come up. Slowly, slowly. Reverse. The left foot is in front. The right is behind. Bend both the knees. And come down. The right heel is coming up, away from the ground. Then come up slowly. Well done. Just relax. Now, we all do that. While doing jogging, the fourth step is what? Hand on the waist, breathe out, bend your knees and go down. We are all doing that in our yogic jogging. The fourth step. Come on, go down more, more. See how much pressure is coming on both the calf muscles. Chest is straight. The longer you stay, the more benefit will come. Then breathe in and come up. Next one, we all do that. Join your knees and do rotation, which we have done while sitting down also. Inward, outward, inward, outward. And if you feel more comfortable, let's say I've got problem with my hip also. So I can't do that close one. I want to take a little bit away my knees. So do like this. Carry on. You're getting all the benefits. The next one is very important. Steps, step up and down. Now let's say my knees are pretty bad. I want to do step. Here we are doing, when we're doing on the higher one and fast, we are doing our cardiac aerobics also. Now let's say my knees are very bad. Always keep a chair nearby. Now these are the steps. Going up and down the stair is another way to increase our mobility of the knee joint. But once it is pretty bad, it's hardly to go up and down. We want to stay down on the ground floor. But again, we have to do exercises to get better. So I am taken very low height, this thing. So step in and up. 1, 2, 3. I'm very slow because I've got a lot of pain. I will show all the variations. 1, 2, 3, 4, 5, 6. Enough. Other one. 1. Slowly and slowly you increase the numbers. Go up to 1 minute doing this only. Now, next one. Alternating. That's what they do in hospitals. All these physiotherapists. Okay. So Mrs. X has improved quite a lot because she is good. She's doing exercises every day as taught by the teacher or the physiotherapist. So I'm much better now. So I want to go a little bit higher because my staircase is like that, you know. So you can take either a little bit lower than this, as I haven't got something to show you. So I have taken this one, which we use quite a lot in our yoga practice now. Again, 1, 2, 3, 4, 5. Enough. Wait. 1, 2, 3, 4, 5. Now you can increase your speed slowly and slowly as I am getting on better. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. See, my respiration rate is gone up. Heart rate is gone up. That is going to help me again for the blood improvement. So these are the things we are doing. Plus, this is very good to increase our bone mass. The osteoporosis plus the muscles are getting active. Other one you do all the time. Even the Tadasana. The pressure goes on the knees, giving other benefits also, as you know. Breathe in, take your arms up, stretch. Now watch your knees. Watch your knees. This is very good for the pain in the heel also, you know. We are getting this pain in our heel because we're sitting for a long time, or if you're walking for a long time, known as plantar fasciitis. Very good. Very good. Carry on. Very good. Relax. So these are the few things you can do at your own pace, and you can add yourself. And you know, let's say, again, I have got too much pain in my knees. So what you can do? You should put something in between your knees, like cushion, and press it hard, sitting. Because I can't do much, you know, still I'm pretty bad. So press it hard. You might be seeing on the social media now, they're talking about some equipment like this, you know, put it on your knees at night time. You can do with your cushion. Only you have to press so that you are activating these muscles around your knees. Press it hard, press it hard. Close your eyes, go on doing chanting inside. Put on lovely music. Put on Swamiji's bhajan. मेरे दाता के दरबार में सब लोगों का खाता. Press, 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 press hard. Press hard. Well, there are some exercise I told you, whatever came in my mind. Try to do it every day, and get better. Go for short walks also, which is the best thing to do. Go for the walks also. No. Well done. Thank you very much. Now I will move over to pranayam. As I said, it takes time, you know, to do it at your own pace. Let's sit straight again. Starting Kapalbhati. Keeping in mind all the precautions, as I mentioned, plus if you're bleeding from anywhere, or you've got headache, or you've got fits, please don't do it. If you had major surgery, don't do for 4 to 6 months, depending upon the type of surgery. Even in minor surgery, we say, don't do it, and then start doing it on the instruction of the yoga teacher or your physician, which one to do and how long to do it. That's very important. The minor surgeries, as you know, nowadays is our cataract operation. Over there also you have to be careful. So these are the precautions. If you're pregnant, don't do it. During menses, don't do it. And these are the things we always keep in mind so that we don't get any side effects. Now I will start with my Pran Mudra. I want to increase the Pran Shakti in my body. Though we are quite active at the moment, this is good for eyesight also. So 1 stroke, 1 second. The power here is either medium or slow. Don't do forcefully. I always looking for a word. I think Shamanji can help me. Is there any word forceful in yoga practice? People say that, which I don't understand. Here we say, breathe in and breathe out fully. Breathe in, breathe out fully. But if you have found somewhere, I would love to know where it is, because this is always in my mind. We say breathe in, breathe out fully. Not forcefully, no forcefully. There's no word as far as I know. As far as I know, maybe I'm one of that person. I don't read too much. I listen to people. That's my habit from the childhood. And I was very lucky even in this country when I got my membership. That is the highest degree with the grace of Swamiji and Mata Rani ji. I got it, MRCOG. I didn't study much, just listening. I don't study, that's not me. I listen to music. I want to sing all the time. So this is the thing. So if anybody has known this, I love to know that. I love to know that. I'm still seeing Swamiji's program. He's never used that word forcefully. No. Though he's doing another forcefully. Do this 1,000 times, every step, because people are very ill. They are all going there with various serious ailments. And that's what we are learning. We are also repeating for a long time. Now let's start Kapal Bharti, otherwise I will go on. So Pran Mudra, 1 stroke, 1 second. Take your mind to the problem you are suffering. The diabetes, take your hand on the area of pancreas and love it, respect it, and say, please get better. Produce more insulin. I want to get better. Give a good smile on the face. If you smile with a facial expression, the pancreas will smile. प्यार से किसी को काबू किया जाता है, गुस्से से नहीं. At your own pace, follow your body. Coming to the fatty liver, which is so common. Most of us are having most probably fatty liver. Some are suffering from hepatitis, liver cirrhosis, liver cancer. Take your hand here on the right hand side, dig it in because there is some fat on the way. The gallstone problem, dig it in, just underneath the liver. People are doing for a long time and they're throwing out their stones in their urine. Or maybe some coming in the alimentary system via fecal matter. The spleen. This is known as visualizing and feeling. That is very important. My full attention is on my pancreas. And these hands got lot of power given by Almighty. When you're touching it also, take hands down for the reproductive system. Carry on, carry on. Now let's say I don't know where are my organs. Where is my liver? Where is my pancreas? Where is my other organs? Put your hand on your navel. That is your Manipur chakra, which is controlling all the organs of the abdomen. You can do like this, press it hard at the umbilicus. Give a good smile. You are activating all the organs of your abdomen. Carry on. 10 seconds, 20 seconds, 30. And according to Swamiji Maharaj, pranam for 1 to 2 minutes even, depending upon the severity of your conditions. Even 10 minutes he is talking now. 10 minutes. We can do at home, not in this class. Time is limited and time flies. Well done. The next one, mudra, as per concern, you people are expert now. Most of the mudras, because our friend is working so hard, you know. The next one is Apan Mudra. Take away all the toxins from the body, including the brain, hatred, greed, anger. Get rid of that. And then rest of the systems are getting rid of all the toxins. To do a little bit exercise with this also, with one action we are doing so many benefits coming through. So you can move your body also. Depending upon how your back, be careful with the neck. If there's a neck problem, back problem, please don't do it. So you do according to your own body. Go on doing Kapal Bharti. You are doing your neck movement, getting extra benefit, activating your thyroid gland, parathyroid gland, getting rid of extra fat from the neck even. So the neck looks as it's gone taller, though it's not, because the vertebrae are the same 7. Carry on. Kapal Bharti with Apan Mudra. I will be moving fast here because time doesn't permit. The next one is your Udan Mudra. You all know that. Put it here to activate all the nerves of the neck, and you are activating this chakra, throat chakra, Vishuddhi chakra. This is the one giving us speech, confidence. This is the one. People whose chakra is not activated, they don't want to talk. They are so shy because of this inactivation. So this is going to activate my vocal cords. With the pranayam, all the chakras are getting activated. And then we are getting energy coming from down to up. Urdhgami. People talk about Kundli Jagran. What is Kundli Jagran? Getting more energy. You can do by pranayam. You can do with your bhajan, kirtan, satsang, Kundli Jagran. That's why Swami is doing more kirtan now. Kirtan yoga. Loud singing, with the clapping, with the dancing. Go on. Well done. The next is for low blood pressure. Ling Mudra. to Kapal Bharti. If you are suffering from hypertension, Pran Apan Vayu Mudra. This mudra is very good for the knee problem. Vayu Mudra. Take away extra air from the body. This pain is because of extra air, that element, which is more in the body, and we are getting pain anywhere, whether that is a cramp, headache, menstrual pain, or joint pains. So this will get rid of all the pain. Plus, it will improve our alimentary system because it increases Jathar Agni. There are 13 Agnis in our abdomen. The strongest one is Jathar one. Jathar Agni. Aham Vaishvanara Bhutva Prani Nam Vibhishitam. You know that. 15th chapter of Gita Ji. God is the one who is digesting everything with his power of fire. So that's what is increased when we are doing this. So, Vayu Mudra, Apan Mudra. Vayu Apan Mudra. How many benefits are coming? This is good for heart also. If you are getting arrhythmia, people are getting this fibrillation, and some are missing the beats also. They are getting very low ejection fraction. That is, the power is less to send the blood to the whole body. The beats are slow, bradycardia, as we say. So this is going to improve my heart function also. This will take away my breathlessness. We are all suffering from breathlessness for various reasons. And that's what they say, going up the stair, we are very hesitant to go again and again up and down because of breathless. Do this mudra for 5 to 7 minutes before going up the stair. When you reach, do again and feel the effect. People suffer from pulmonary fibrosis. If you are practicing pranayam, especially Alom Vilom, Bhadrika and Kapal Bharti, if you have pulmonary fibrosis, please go for the test again. Spirometry will tell you when you blow out in that instrument, and the doctors get surprised what you have done. It is so much good, you are normal. Effect of pranayam. We are very lucky. Swamiji has taught us everything. Carry on practicing. Kapal Bharti with Apan Vayu Mudra. Coming to Varun Mudra. As the eyes problem was mentioned, this is the one going to help me. Varun Mudra, increasing water content in the body. Eyes also need that. So this mudra is very, very important. This one, and Pran Mudra for the eyes, and acupressure, we all know. Acupressure. Okay, I'm moving on into next. Ujjayi Pranayam, which is very, very important pranayam. They call it victorious breath. Victorious. You get victory on everything. Good for the respiratory system, even for the asthma. And activation of thyroid gland, parathyroid gland, vocal cords. And when you do with Khichri Mudra, do Ujjayi Pranayam, you got that, but people are talking about Kundali Jagran and meditation. So many benefits. Good for heart and lungs. Even on the face, you get nice glow on the face. I call it anti-aging, anti-wrinkling. It opens up all the sinuses. Speech, for speech defect, this is the best one because you are activating your vocal cords. And then if you are a singer, I call it a singer pranayam also. Do this 3 to 4 times before you start singing. See the difference when you start singing. The voice is so harmonious. And so many other benefits, innumerable. Take away the fever also. Balance the weight also. So how to do it? I usually do with Vayu Mudra because I suffer from pain. So here, constrict your neck muscles, sit up straight. Relax your body and the mind. Sometimes we say cough few times so that clear your throat from the mucus. Now, squeeze your neck muscles. Put one finger here. I will tell you why. Do your Kichri Mudra. Go on breathing. From the nostril, the sound will be like snoring sound. Because this is anti-snoring also. Here we are not snoring, but this is just the movement is occurring. See what is happening. You can feel this area I am using, the vocal cord to do. Otherwise, sometimes, we do from the nose, which is no good for this. Sometimes the sound comes from the nose. But once you put your finger there, you are concentrating more. Your focus is on your vocal cords. So, give a smile also on the face. Your face is glowing up. Then you can't breathe anymore. Bring your chin close to the chest if there's no neck ache. Again, don't hold your breath. Please, please, if you are suffering from hypertension or heart problem, never hold your breath. That is your kumbhak. Don't do kumbhak. So if you're not having those problems, no neck problem, no heart problem, then no hypertension. Here hypertension means even after taking medication, your blood pressure is not under control. Maybe there's minor hypertension, doesn't worry. Okay? So hold your chin close to the chest. How long to hold depends upon your practice. Then you can't hold, then straighten your chin, close your right nostril with the right thumb. Exhale from the left. So here, little bit we are conscious about holding also because of this COVID, because we don't know how many people are really having. An unfortunate story is with these new variant, there are no symptoms. First 5 days, there's no symptom, and suddenly they attack the lungs and the person is gone to hospital. And their future is, God knows. So that's why we are a little bit conscious this time, holding the breath. Otherwise, there was no problem before, So this is the one. Once again, I will do it. Put your hand there. Next is humming. We all know that, but we have to do it because we want to increase our nitric oxide, the best way. Now here in this step, whole action is here because nitric oxide will be coming from there as we are activating our vagus nerve. Not from there, okay? Not from there, here. So close your ears, breathe in, breathe out, then start doing humming sound from the nose. Do it only twice because time is running. Well done. Next one is the Bhamri Pranayam. Alom Vilom. From Alom Vilom, we are going inside, Antarmukhi. We are trying to go to the target. We want to achieve the samadhi, the union of the soul with the super soul. आत्मा परमात्मा से मिलन, एक हो जाना. We started from here, from our Anlom Vilom. And there are so many benefits, innumerable. You can't even count. This is the balancing pranayam, very cooling pranayam. Get rid of any problem, because we are going to open up all the channels, the nadis and the blood vessels. Good for the heart and lungs, for the bones, for the blood, for the skin. Get rid of extra fluid from the body. Get rid of any type of headache. Good for the vision. Improve the vision by doing this. So let's do for short time. Alternate nostril breathing. Surya Nadi and Chandra Nadi. Balancing the brain. Balancing our ahar, vihar, vichar. Shanti and Kranti. Production of good hormones. Try to practice 4 times a day. You can do after 2 hours after taking meal even. Empty stomach. Before lunch, before evening tea, and going to the bed also. Get nice sleep, lovely dreams, either no dreams or lovely dreams. Maybe one day in that lovely dream, Swamiji's might come. You never know. You never know. He's always there. He's always there. Good for all the system, the central nervous system. MS, Parkinsonism, multiple neurons disease, stroke, dementia, which is so common, anger, greed. Good for the circulatory system, cardiovascular system, respiratory system, reproductive system. People are getting pregnant after 20 years of infertility. Just following Swamiji's protocol very seriously for a long time. Now, next move over to our Bhamri Pranayam. Here again we are going up. Good for insomnia, take away anxiety, for hypertension, heart problem, and going close towards our samadhi, step by step. Udgit pranayam. 8th step known as Pranav Pranayam. Pranav means Om. Fix your mind either on your breath or the third eye, Ajna Chakra. Go on chanting the Lord's name inside. Silent meditation. ध्यान की अवस्था में आप बैठे हैं. Any word, any shabad, any dhun, any mantra. Feel the presence of Almighty. And be in the state of gratitude. मैं अकेला नहीं हूँ. मैं अकेला नहीं हूँ. I am never alone. The supreme power is always with me. We are thankful to Almighty who gave us strength, the guidance, how to do yoga. Thank you, thank you, thank you. Raise your arms up, rub your palms, put the palm on your eyes. Slowly open your eyes and you move down. Singhasan just twice only. Very good for the voice. Clear up everything. Clear the sinuses. Ah, 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 ah. Give a good laughter.
Ah, 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 ah. Ah, 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 ah.
Ah, 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 ah. Ah, ah, ah. Thank you. The closing prayer. Sarve bhavantu sukhina. Sarve santu niramaya. Sarve bhadrani pashantu. Ma kaschit dukh bhag bhave. Om Purnamida Purnamidam Purnyat Purnamudachyate Purnasya Purnamadaya Purnameva Vishishyate. Hari Om Tat Sat. Hari Om Tat Sat. Hari Om Tat Sat. Om Shanti Shanti Shanti. Thank you very much, my friends. Please, you can give me your comments. If I have said something wrong, let me know.
Thank you, Kapurji. It was a very good class. We learned a lot about knees. Thank you very much.
Thank you, Dr. Kapur. That was excellent. I was watching you. Excellent. Done all the knee exercise, everything perfect. Excellent.
The only thing
Kapurji.
is when
That was
you are doing
fantastic.
session, you can't see others. So you carry on.
I know. That's why it happens with me. I
You
know.
carry on.
I
But
know.
never mind. You are always with me, all of you.
I know.
And this is
Oh, it
all
was
is happening with the
Thank you so
grace
much.
of Mata Rani and Swamiji Maharaj.
That's the best.
He is always there watching us what we are doing.
Very nice.
He is
Kapur.
very
Very
clever.
nice. Thank you.
Thank you.
Thank you,
Thank you.
Mila.
It was
It's good for
lot of
the knee.
information.
Very good.
Thank you.
You made us to go on a marathon now because the knees is getting better now.
Of course, of course. Of course.